So in studio for this conversation on healthcare financing is Dr. George Ogot, who is from the Kenya Medical Practitioners and Dentists Union. And many thanks for joining us on Worldview.
Thank you.
So let's just begin with the statistics that Zinzi has painted for us there. 2.1 billion shillings withdrawn by the US government. What impact is this going to have on the healthcare sector in general?
From the outset, let me say that it's unfortunate that development partners have found a reason to withdraw their support, which I believe Kenya is really in need of. But it's critical also for those of us who commentate on these issues to try to understand how this funding comes and the accountability mechanisms that I think ought to go with them. In terms of the impact will be huge, because I know for a fact that the bulk of the prevention and promotive health financing in this country comes from development partners.
Right.
So if 2.1 billion shillings has been withdrawn, I think the impact will be huge in the sector.
I mean, we had the CS, Cleopa Milo, respond to this, and he said, yes, there are issues of integrity in Kenya's Ministry of Health, but following the withdrawal of this funding, the major departments in the health sector will not be affected. What is the likelihood of this?
If you look at the amounts that have been suspended, they are not really targeting the core, what I call core human intervention issues. They have targeted trainings, they have targeted salaries for support staff, they have targeted conferences and international travel. That is not to say that they are not important. What I'm just saying is that I call them the supportive elements of the system. The core of most of this funding usually goes to things like procurement of antiretroviral drugs, procurement of antimalarial drugs, testing kits, and basically procurement of TB medications. As we all know, maybe if you don't know, I'll just say that most of malaria, HIV, and TB medications are actually donor funded in this country.
Right.
So to the extent that the US government has seen it fit not to cut down on that, I think they have shown a humane face despite the challenges that could have been there. But let me try to explain so that Kenyans probably also need to understand exactly how this donor funding usually comes. I happen to have served this government some time back as a district medical officer of health. So I've been an accounting officer for some of this money for a certain district at some point.
Right.
And during that time, I was privileged to be among the people who are trained basically to try to look at how to superintend over these funds. So it's important for Kenyans to understand there are three critical players when it comes to donor funding to the health sector in Kenya. The number one critical player is the Ministry of Finance, or rather the National Treasury. The National Treasury comes in, I think, in 2 or 3 ways. Number one, the National Treasury usually issues guidelines on how to manage these funds to the implementing agencies or ministries.
Right.
Number two, the National Treasury is responsible for what I call the accounting function in most government offices. So most accountants and people who handle these funds are actually officers from the National Treasury seconded to the ministries. Number three, as you may be aware, the National Treasury hosts the internal audit function of the entire government, basically. So whenever such kind of issues arise, I don't think it's entirely correct to single out the Ministry of Health. The National Treasury also needs to come in and say, in their role as those who issue guidelines for handling these funds, what have they done or what shortfalls are there?
So it is a multi-institutional.
They also need to come in and tell Kenyans in their role as the chief internal auditors of government donor funds, or basically government funds, what have they done or what are the issues? The second institution that comes in is, of course, the State Ministry of Health, which basically is the recipient and in the implementer or the user of the funds. Thirdly, the Kenya National Audit Office, the Office of the Auditor General. The Office of the Auditor General acts as the external auditor for all funds used in government.
Right.
So these three institutions owe Kenyans the answer to what the
went
challenges
wrong,
are.
and of course the
The
Ministry of
National
Health.
Treasury, the Ministry of Health through the accounting officer who happens to be the principal secretary, and the Kenya National Audit Office through the Auditor General.
Right.
These three offices know
Now, of course,
exactly
if
what
it is
going.
all these other offices and institutions outside, then that brings a bigger problem, because then it is not just international donor funding to the Ministry of Health, because these same institutions deal with a lot other sectors.
Yes.
But let's focus more on the health sector, because as it is, about 3 billion shillings cannot be accounted for from UNICEF alone, money directed towards the Ministry of Health. So how much bigger is the situation? Are we expecting more international donors to pull out?
That would be very unfortunate, because I know for a fact that even though we come from the union side, the unionists tends to always just fire.
Right.
But I think we are also citizens of this country. Some of the people who are benefiting from these funds, they are our mothers, they are our fathers, they are our children, they are our brothers and sisters. So whenever an issue like this arises, we need to put the issues in context and actually get to the bottom of the facts. So I would also request the media that we go beyond the sensational reporting to a factual investigation of exactly what is the chain of custody of these funds. It would be very unfortunate if UNICEF follows the US government, or I know there are also donors like DANIDA. I know there are also donors like even WHO, World Health Organization. There are programs that they fund. As a Kenyan, I would really wish to urge them not to pull out the finances. But also on the line of accountability, I would like Kenyans to start asking, first, the National Treasury, to come out clearly and tell Kenyans exactly how these funds are received into the country, how they are distributed to the implementing ministry, and how they are utilized by field officers, and the returns backward. That it does by facilitating the flow of funds downwards, coordinating the internal audit function, and 3, the ministry as the implementing agency is responsible for generating what I call the accounting returns. If you gave me 250 million to go do XYZ, the principal secretary, State Ministry of Health, has to come back and report. I used X to buy mosquito nets. I used Y to procure ARVs. I used Z to train this number of people on ABCD. And the Kenya National Audit Office, headed by the Auditor General, now reports on what I call a quality assurance external audit to confirm that indeed what the ministry as the implementing agency is saying is the correct position. I believe strongly that if that is done, and if these 3 institutions play their role as envisaged in law and envisaged in the Constitution, there is absolutely no reason why donors should not support Kenya.
Let's go back to the impact of this, because this again will help inform what really these other institutions and individuals have to answer to.
Yes.
So earlier on, Zinzi Kibiku gave us some statistics, and of course you mentioned that this funding from the US might not affect the core sectors or the corporations of the health ministry, but she did single out a few things like family planning, maternal health and nutrition, and other sectors in terms of fighting HIV in the country. Are these likely to be affected by this pullout?
Let me first of all explain that currently in the financial year 2016-2017, the Kenyan health sector is generally grossly underfunded.
But according to those statistics, that was the highest budgetary allocation
From
yet.
public, it's two-pronged. From public taxes, we are running a budget deficit in the health sector of close to 200 billion on a conservative estimate.
Right.
So when the donors come in to plug this deficit, definitely there is already a need that is met by this donor financing. So anytime a donor withdraws even a penny or just 1 million shillings, the impact is felt directly.
Right.
So to that extent, I would really not wish that the US government carries through and withdraws this funding from this sector, because I know the impact will be huge. It will impact on some of the things we do under this program. We call them like support supervisions. For example, if you're at the district level, you know antiretroviral drugs are being distributed. But there must be a support system to it. One support system is laboratory testing for example, CD4 counts. It may not be the ARV itself, but it is a support system probably funded by this.
Right.
Number two, you have to send sometimes officers to confirm, to be on the ground, to actually see how the storage is happening, to actually see whether the accountability forms are also being done properly. So even if they keep supporting what I call the human bit, the actual core issues, the support issues also need to be funded. So I still believe that if that funding is indeed withdrawn, it will affect Kenya negatively.
All right, so let's move away from that, even as we continue keeping an eye on it. And as we wind up, there's been word of another possible doctors' strike coming from the Kenya Medical Practitioners and Dentists Union. What is brewing really among doctors in this discontent we're seeing?
I think as far as the doctors' union is concerned, there was a painful 100 days of a strike that to begin with was really unnecessary because issues leading to the 100-day strike was a contentious CBA which was signed in 2013. The CBA was signed, that's a fact. We witnessed it, I witnessed it being signed.
Right.
So the fact that, the other party felt uncomfortable about a few things. But be that as it may, the people went on strike. Somehow the parties after 100 days were able to agree on certain ground rules of how they are going to resume their relationship. I believe as people who respect the rule of law and persons of honor, whenever you sign a deal and say, okay, these were the grievances, this is the roadmap of how we are going to address them, we need to be gentlemen and gentle enough to really move forward on our word, because they are saying that if you are a gentleman, your word is your bond.
All right.
From the union side, our word remains that the items as covered on the return to work formula of March 2014, we shall respect the terms of that return to work formula to the letter. But we have noticed from the other side, the national government and the county governments, when I look at them, the picture I get is a picture of a team that is really at war with itself.
All right.
It doesn't know where it's heading.
This is a conversation we'll have to continue, George.
Yes, I would really want them. They need help. I'm not. When I look at them, it's like they need help.
All right, this is a conversation we'll have to continue at a later time, even as we get word from officials from the Ministry of Health, Dr. George Ogot, there from the Kenya Medical Practitioners and Dentists Union, putting into perspective what it means now that the U.S. has pulled down 2.1 billion shillings of funding to the Ministry of Health.